Uh, Today, I'm going to give you a tip or give you a couple of points which can be used for treating any lower back pain or paralysis or weakness or numbness of the lower limbs. So these are points that are taken from the YNSA technique, or the Yamamoto New Scalp Acupuncture technique method. And I'll be giving you these points so you can use them in your clinic. They have a very strong and good effect. So I'm going to move to my PowerPoint so you can see the location. Okay. So the first point I'm going to be treating or speaking about is D point. If you can see the location here of D point has an effect of any pain or weakness or numbness of the lower extremities from the navel down to the feet or the lower foot. So even if you have patients suffering from PMS, for example, it can also help them, these females. If you have any urinary construction, it can also help these patients. Also for abdomen pain, lower abdomen pain, and etc. But also lower back pain and sciatica. Now, the D point is actually what I've drawn out. The blue line here is actually an imaginary line, which is located, which you draw from the root of the ear towards the outer canthus of the eye. And the point is located where this line crosses the front hairline of the sideburn. What you want to do is palpate this point and look for sensitivity. And when you found the sensitivity, you needle it. And this will have an effect on the pain in the lower back. Now, this point also has a needling direction. For example, if you want to have an effect on any radiating pain which is going to the inner part of the thigh or on the stomach spleen meridians, you'll be actually needling from the ear towards the eye. And also think about it also effect on the weakness of these muscles. So if the patient is having a problem with the hip flexion, you can actually needle this point and it'll have an effect on the iliac psoas and the quad, and help in walking disabilities with that. Another direction is from anterior from the eye to posterior, from the eye towards the ear. This will have an effect on the radiating pain on the bladder or on the back muscles. For example, the gluteus, maximus minimus, and the piriformis muscle. So if these muscles are causing the pain, or if these muscles are weak, by needling in that direction, you have an effect on these muscles, or radiate pain towards the bladder. Another direction is from up to down, towards the zygomatic bone. This will have effect on the gallbladder meridian. So this also affects the tensor fasciae latae muscle. So by needling it, you will have an effect on radiating pain there and other pain. So that's point number one, which is called D point, the D-yin point. The next point, which you can see I've marked here in black, is actually the area where L1 and T12 meet on the vertebrates. This area has a lot of tension in it, and a lot of patients are suffering from pain in this area. And what you want to do is relieve the tension or the tension in this area, and by doing so, you'll actually have an effect on the back pain of the patients and relieve this pain. And this point is actually what I try to draw out here is I've taken the apex line, okay, a straight line just above the apex, and multiply the ear by 2. And in this area, I'll be looking for sensitivity. Like the D point, this is not important, the direction of the needling, but all you want to do is just look for sensitivity in this area. And once you have found sensitivity in this area, needle it. So that's point number 2. Point number 3 is F point. F point has an effect on the piriformis muscle and sciatica. And by needling this point, you also relieve the pain in the sciatic area or on the gluteus area, on the where patients are sitting. Now, this whole area has an effect on the whole buttocks. So if they have contraction of any muscle there, which is causing pain, by needling it, you'll be relieving this tension. This point is actually located just about a centimeter just above the mastoid process, the sting of the mastoid process on the bone between, let's say, between Sanjiao 17 to Sanjiao 18. So you look for sensitivity there in a lump. The next point is the F point, which you can see is located on the zygomatic bone between stomach 7 and the upper area of the zygomatic arch. On the bone, you found a notch on the front hairline. And this has an effect on the foot, sort of treat paralysis of the foot, numbness of the foot, and etc. Now, also this point has an effect on a direction. If I needle it towards the eye, I'll be affecting the dorsal area of the foot. If I'm needling it from the eye towards the ear, I'll be affecting the plantar area of the foot. So spraying is to needle into, if you have a sprained ankle, you'll needle it, or drop foot, you'll needle it towards the eye. If you have plantar fasciitis or any numbness or walking on bubbles, especially on diabetics patients who have neurological areas problems, you'll needle it towards the ear. So these are the 4 points. I hope you will use them in the clinic and it will be, you'll found them useful. Enjoyed this tips, and have a good day and a good week. See you around.